Controversial guidelines for prostate cancer screening get an update, conflicts in breast cancer guidelines lead to differences in care, and Florida weighs work requirements for Medicaid. Welcome to This Week in Managed Care. I'm Laura Jose. The U.S. Preventive Services Task Force caused an uproar 5 years ago when it changed guidelines for prostate cancer screening, causing a sharp decline in routine PSA tests that catch this deadly cancer when it is still treatable. This week, the task force gave a new recommendation that calls for individual decision-making for men ages 55 to 69 in consultation with their doctor. Said task force member, Dr. Alex Christ, prostate cancer is one of the most common cancers to affect men, and the decision about whether to begin screening using PSA-based testing is complex. Treatment for prostate cancer can cause incontinence and erectile dysfunction, and in cases of slow-growing cancer, a watch and wait strategy may be recommended, aided by diagnostic testing. Chris said men who are considering screening deserve to be aware of what the science says. There's also controversy over when women should have mammograms based on conflicting guidelines, and a new study shows that has caused different levels of care. A new study from JAMA Internal Medicine finds that 3 sets of guidelines from USPSTF, the American Cancer Society, and the American College of Obstetricians and Gynecologists cause women to have their first mammogram as young as age 40 or as old as age 50. An editorial found that the fee-for-service system can encourage too much screening, which can be harmful. The authors wrote, ultimately, alternative payment systems that value evidence-based patient-centered outcomes would improve patient care, choice, and satisfaction while decreasing wasteful spending. Florida may require Medicaid recipients to go to work or show why they aren't. Members of Florida's House of Representatives this week weighed a proposal that would require able-bodied people in Medicaid to show proof they have a job, are looking for one, or are enrolled in school or job training. The proposal also calls for recipients to pay monthly premiums of $10 to $15 based on income and would end benefits for 12 months for those who skip premiums or don't meet the work requirements. Florida's action comes after CMS sent a letter to the nation's governors stating it would be open to Medicaid waivers that include work requirements. For more, visit ajmc.com. Rising rates of obesity among teens are a problem across all ethnic groups, but a new study shows how the link between obesity and high blood pressure is especially strong among Hispanic teens. A study in the journal Pediatrics, based on 15 years' worth of data gathered at school clinics in the Houston area, found that obese teens who were Hispanic were 6 times as likely to have high blood pressure, a rate much higher than obese teens who were white, Asian, or Black. By contrast, Hispanic teens who were normal weight were least likely to have high blood pressure of the 4 major ethnic groups studied. The study illuminates risk factors in the Hispanic population, which is more likely to develop diabetes, heart disease, and kidney failure as adults than the overall population. CDC reports that 50% of Hispanic adults will develop type 2 diabetes in their lifetime, and Hispanics are 66% more likely to develop chronic kidney disease than whites. For more, visit ajmc.com. There's still time to register for the spring meeting of the ACO and Emerging Healthcare Delivery Coalition, which meets May 4th and 5th in Scottsdale, Arizona. Featured speaker Ovik Roy, keynote speaker Darius Lakdawala, and an ACO favorite, the Healthcare 2020 series, will offer insights into where payment reform is headed under the new administration. For information and to register, visit our conference page at ajmc.com. For all of us at the Managed Markets News Network, I'm Laura Jose. Thanks for joining us.